Hello everyone, this video will discuss the procedures needed for bleeding time. The laboratory evaluation for hemostasis may either be under the primary or the secondary hemostasis test. Bleeding time is under the primary hemostasis, which tests for any defects in the blood vessels or the platelets. Bleeding time is a test that can determine how long it takes for a wound to stop bleeding. Given this definition, bleeding time therefore can estimate the integrity or the quality of the primary hemostatic plug, which is also known as the platelet plug. With this, it can give the interaction of the capillary and the platelets with each other. Given this principle and definition, we can now say that bleeding time is dependent on several factors. First is the platelet. A decrease in the number or an abnormality in the function of the platelets can increase the bleeding time. Other factors would be the absence or the decrease of some of the plasma components that are needed in the formation of the platelet plug can also increase the bleeding time. And also, tissue vessel wall composition is important since these play a role in the interaction with platelet for the formation of the hemostatic plug. These are the different methods for bleeding time. First is the Duke method, which is adopted in the year 1910. The site of puncture can either be the earlobe or the fingertip. Reference ranges can be less than or equal to 6 minutes or 1 to 3 minutes depending on your location and the reference material used. The next method is known as the IV method, which is adopted later than the Duke method in 1941. The site of puncture is the forearm and the size of the incision is 2 millimeters long and 3 millimeters deep. The next method is known as the template method, which has the same site of puncture as the IV method in the forearm, but the difference in the size of incision. It is longer at 5 millimeters long, but shallower at 1 millimeter deep. So in this picture, it uses a spring-loaded lancet to give a standard incision at 5 millimeters long and 1 millimeter deep. Instruments that use this method, examples would be the Simplate and the Surgicate. Reference range would be from 2 to 9.5 minutes. The next method would be the McFarlane method, which is just a modification of the Duke method. And the last method is known as the Alderson-Crosby method, which gives an incision of 6 by 6 millimeter. These are the following steps in the IV method used for bleeding time. First is to inspect the site of puncture, making sure that there are no visible vessels, rashes, scar, swelling, bruises, or hair. Hair should be shaved off if necessary. And to assist in the detection of the vessels or the capillaries, we can inflate the cuff to 70 millimeter mercury. The site of puncture is the volar surface of the forearm. The next step is to cleanse the area and to make sure that it has dried properly. Next step is to inflate the cuff to 40 millimeter mercury, and this should be maintained in the succeeding steps. This is done to exert a uniform pressure and to control the intracapillary pressure. The next step is to make 2 incisions that are parallel to the elbow crease. The incisions should be aligned with the middle finger and below the crease of around 5 centimeters or 3 finger width. After that, you have to blot the blood every 30 seconds on a filter paper. Make sure that the wound itself is not touched because this can dislodge the platelet plug. The test is completed when blood ceases to stain the filter paper. Afterwards, we have to report the average from the 2 incisions. The reference range is 2 to 9 minutes. To know the bleeding time, you can count the number of drops on the filter paper and calculate for the time. Make sure to write the bleeding time on the filter paper. These are the common sources of error when performing the IV method for bleeding time. After the BP cuff is inflated, the incisions should be made within 30 to 60 seconds, and the time interval between the first and the second incision should only be 15 seconds, and the incisions should agree up to 1 minute. The patient should arrive 15 minutes before the test to avoid cold or sweaty extremities. And when performing the IV method, a scar on the forearm may be seen, so a butterfly bandage may be used. There are also some drugs that can affect or that can increase the bleeding time. Examples would be aspirin, nonsteroidal anti-inflammatory drugs, anticoagulants, and some antibiotics. The IV method and the Duke method may be affected by the following as well. Certain non-platelet variables may affect these tests: the thickness of the skin on the puncture site and the size and depth of the wound. Example causes of abnormal results may come from von Willebrand disease, defects in the platelet either by the number or by the function, vascular disorders like scurvy and vasculitis, and defect in fibrinogen, a decrease or the absence of fibrinogen. That is all for this video regarding bleeding time. Thank you very much for watching.